Welcome to another edition of my podcast. My name is Brett Lovins. I've been sober now 9 years, 4 months, and some change, but who is counting? I'm not unique. I'm one of millions of people who have a condition that is treatable, and I've quite by accident become an advocate of it. So it's not by accident. Obviously, I'm recording a podcast and everything else, but this is something that I've been slow to embrace. I won't speak for everybody, but it's not as common for people in recovery to share it openly because of the shame and stigma that hangs around this disease. And I think that's a problem because I think that a lot of people like myself who, just felt so unique and alone and confused that they just didn't know that they're not, and it's treatable. So I guess I've just become willing to be a voice for it. And how this all started was about 3-4 weeks ago when I approached the benefits team at Cisco. Wonderful group of people. I work for Cisco Systems, the big IT company where I think it's 70,000 people. It's a giant company, and they were receptive to hear from me, and I was just wanting to advocate for addiction resources. We already have a robust program at Cisco, but they were open to hearing my thoughts around it. And turns out it lined up really well, or synchronistically, with Mental Health Awareness Week that they were going to be having some speakers for and some additional resources around mental health in general. And of course, addiction flies in formation with mental health issues as well. And so anyway, we ended up having a call with our behavioral health director, a woman by the name of Dr. Mira Zein. She's also the clinical assistant professor of psychiatric and behavioral sciences at Stanford University. So she's seen some things, she knows some things, and she's sort of well known at Cisco because she's on most of our company-wide calls, particularly around mental health issues. So the opportunity to talk to her was really cool. And they said, okay, well, what do you think about us recording it? Since you seem to be willing to talk about your condition, why don't the two of you have a conversation about this topic? And we'll put it on the internal website to Cisco Systems for, Mental Health Awareness Week. And I said, oh. And then I said, you know what? It's time. So, I've been wanting to be more out there and be a voice of recovery for probably 4 years. This is kind of where I started thinking about, I should be more out there with this thing to help people, right? So I said, okay, let's do that. So Dr. Zein and I had a conversation. We didn't plan any of it. This is just off the cuff, two people talking, cover a lot of topics. Huge shout out to the benefits team, particularly Sheila and Natalia, and a huge shout out to Dr. Zein for being willing to let me put this recording from a Cisco resource out onto the web as part of my podcast. So you will hear some references to some Cisco specific resources. Just insert your own local resources into that, or if you need to find out more information, a great place to start would be shatterproof.org. And but anyway, we cover a lot of topics. I think it's really cool. I think her thoughts on mental health and addiction and treatment are awesome. So hope you enjoy the conversation. And again, thanks, Dr. Zein, for being willing to let me put this on my podcast. Enjoy.
So I think it can be helpful, right, to think about the story and how the story relates to a broader picture of looking at, right, substance use in the U.S. and globally, and how it is stigmatized, and also how to think of it from a mental health and biology perspective, and that there are things that can be done to help, right, and that people don't have to suffer, with this on their own, because it can be very destructive and it can, destroy people's families and destroy their lives. I've seen patients with right, liver transplants or being rejected from liver transplants who have, had alcohol consume their lives. And so I think it's really important to think about substances as, things that impact our mental health and are a mental health issue as opposed to a moral failing.
Right.
Yeah.
Yeah, which is a tough one, right, for a lot of people. I personally, when the little voice was talking to me about making a change, which really started a long time ago, but started getting louder, I attempted moderation. And for a lot of people, moderation can work. But for people like me, and I would suspect hundreds, if not thousands of people, maybe even our company, moderation didn't work. And I tried for 7 years. Hard.
Yeah. Yeah.
7 tough years. And you said the word suffering. And that was some suffering time with, cravings, the obsession in my mind, the amount of bandwidth of my life that was required to try to keep one foot on the gas, one foot on the brake. So.
Yeah. And I wonder, right, because I don't think most people know how complex of a disease in that substance use is, right? Because I think people are like, oh, people just start using alcohol or using drugs, and because they can't, control themselves, this is what ends up happening. And so I wonder, right, because first thing I think about is okay, what are the biological risk factors for somebody? What are their social, and psychological circumstances that lead them to that point and then perpetuate it for them and make it harder and harder? Because once you're on that track, then your brain, there's all these changes that happen. So I think for you, like, for instance, right, do you have people in your family who, drank alcohol excessively and other things excessively?
Yeah, well, there were some for sure. And there were some that didn't. So, but I was one of the ones that did. And yeah, it goes back through my family as well. Absolutely. So I believe in the genetic model as well.
Yeah, no, there's absolutely a lot of evidence out there that there are genetic preloaders that make people at higher risk, right? If you have people in your family, then absolutely that increases the risk.
Yeah.
Yeah. Do you want to tell me a bit about, if you feel comfortable, what it was like? When did it start happening for you in your life, and when do you feel it got out of control?
Yeah, for me, it started very early. I had my first drink when I was 13. And started smoking weed around the same time, and that unlocked the keys to the castle. As far as I was concerned, that was going to be me for a long, long time. And so, and there were plenty of little bits of evidence along the way that told me that I didn't drink or use drugs the way normal people do or other people around me. And so I surrounded myself with people that did it like I did it. But in terms of being an employee at Cisco, right, I've been at the company 11 years, and I've been sober 9. So there were 2 years there. The final 2 years for most people like me, those last years are not a lot of fun because it gets the progressive nature of this thing. I am a poster of it, and it got worse and worse. So I knew that there was a problem, and I started to try to moderate. And like I told you a few minutes ago, like I tried for seven years with failure after failure after failure after failure, and just being frustrated and confused. And, my life, I do so many things so well. Why is it that I can't, once I take a drink, why is it that I find myself unable to stop? So yeah, when you ask, well, when did I discover it was a problem? I think I discovered it was a problem. Like most people that I talk to with this condition, that they admit that little, I call it my small voice. It was a small voice talking to me for a long, long time about, but then that other voice that was loud and said things like work hard, play hard, and all that, would get me to take a drink. And as soon as I did, then it was over. I was going to go to the ends every time.
Yeah. And how much of that do you feel kind of in terms of, right, social expectations and, just kind of normalization, especially in a work environment, of going out afterwards and getting drinks and feeling that pressure and feeling like you couldn't, right, say no, and that there was this shame of, I'm not, if people might think of me in a different way.
Well, in my case, my story is, I, like a lot of people, I kept it secret, right? My shame around this was very, very secret, even to myself in some regards. Really, the only time I could be honest was after I'd had quite a bit to drink. And it was pretty much every night after I put my wife to bed, I would stand in front of a mirror and I'd ask myself a very simple question. Hey, Brett, are you having a good time? Is this fun? And the answer was the same every time. The answer was no. So when I take myself into Cisco, those last 2 years, I worked 2 Cisco Lives as somebody who drank, right? So the beer carts roll out. I'm on board. In fact, I'm going to be very interested in that. So where it got weird for me is Dr. Zane, this is where it's kind of, everybody's got their story. My story is I got sober and it just so happened that it aligned with my 3rd Cisco Live to work. So I'm 15 days sober and I go to Cisco Live. Now your question has pertinence, right? Now I'm surrounded by people that are just as enthusiastic about it before. And I can remember specifically being at a restaurant with, people I work with, people above me in the chain, standing on chairs in a Greek restaurant, taking shots of ouzo. And me having the tiniest bit of sobriety, the longest I'd ever been sober. And then to answer your question, that's where it was starting to get weird. So, and since then, when I go out and around and stuff, I think most people don't really know about this condition, that they're walking around people with this condition. So, how do they know how to navigate? I was the first one to make sure everybody had a shot. I understand that it's not everybody has this, but now it's a little trickier. And I think for a lot of people like me, when we go to events like Cisco Live or Impact or go to an offsite or whatever, if the team doesn't know, and that's okay. I mean, I'm not saying everybody has to tell, but in my case, I've gotten more comfortable, obviously, talking about it. And so it is a little tricky, right? It can be tricky. And I still marvel that I was able to get through that first Cisco Live, that 15-day sobriety, that I was able to get through that. That's
really impressive, actually, because a lot of people can't, and there's nothing right and completely understandable because your brain is still in a very fragile state at that point.
Yeah.
And I don't think most people understand also, right? Because most people can drink, and you get positive reward circuitry in your brain, and you get some dopamine, and then depending on how much you drink, you might feel awful, and then you might stop, and you might drink here and there again. But for people, there are people, right, due to genetic reasons and other reasons, they're kind of a ticking time bomb of once they start and go down that path, it starts escalating. And there are changes that happen in the brain, right, that end up making it so it's really hard, right? People are just like, well, you can just quit anytime you have the willpower to. It's like, no, absolutely not. Your brain actually starts changing. Circuits start changing. So the front of your brain, which kind of is our control center and kind of keeps down those urges, completely gets down regulated. So it's not working anymore. You've just got this reinforcement loop that pushes it forward despite your best intentions. So I'm actually really impressed that all of that, because I'm sure you were having like signals going on in your brain going like, we're just doing this. Why can't we go back and do this? Because your body has to then adjust to all of those changes and all of those imbalances that grew over time.
Yeah. Yeah. And that circuitry stuff, I'm fascinated by that as well. I've often used the analogy of Gollum. like it started out as a party trick and slowly but surely. Mm-hmm. And I can remember one time being in the basement of my house where I'd gotten to the place where I was hiding it, right?
Yeah.
And I was down there sneaking a drink, and I remember whispering out loud to myself, nobody needs to know. And it came out of my mouth, right? And I'm going, whoa, what was that? I think about
You had a Gollum moment. Yeah. Right. And Gollum, right, started after the right interventions, getting a little bit better, but then of course made it worse again. And that's the tale for so many people, is that, right, with the right, it takes a village of people, in the right place and the right time to help someone be able to stop, especially if they're not in that mindset. If they're in the mindset, it makes it easier. That doesn't mean their brain is necessarily ready. Their brain needs a lot of support because their circuits are so changed at that point.
Yeah.
Yeah.
Yeah. And for me, and I'm not saying that I have my story, but I've seen patterns. I look for evidence with people that I know with this condition. And it seems to me that knowing other people with it is useful. Because I remember the first time that I went to a meeting, AA in my case, I call it the Starbucks of recovery. There's one on every corner, mostly consistent. And I started hearing people talk, and I was in the back and I was quiet. I didn't want anybody to know I was there. And when they start talking, I'm hearing my story. I'm hearing from ages, doesn't matter. They're saying they're telling me the things that I've been dealing with for years, and all of a sudden I don't feel so unique or so alone. And that's one of my things about even being willing to do this, is just to be one of those people potentially that somebody sees this and goes, "Oh wow, maybe it's worth exploring."
Yeah, and I think that whether it's AA or whether it's Smart Recovery, which is a cognitive behavioral therapy based type of group model, it's really important to know that there are other people that have this journey.
Yeah.
And that you can see, and people will be at all sorts of stages of it, right? And that's not unique to alcohol, right? That's the same with people who use opiates, and opiates right now, if we think about alcohol, I think has been there, and we've definitely seen it go up with the pandemic. But if you look at general trends, overall, some substance use is declining, but like opiates skyrocketing, especially fentanyl, with like the new fentanyl on the streets, benzodiazepines, things like Xanax, right, going up. And so that's true for any of these things, that knowing that it's there, and then getting professional support if that's relevant. Were you ever on medications? Because for some people they need it and some people they don't.
No, I wasn't. I didn't know anything about medications till probably year 2 or 3 of sobriety. And then I learned about it through somebody that I went to a breakfast with, and he was going through a military program, and they had prescribed him, and I can't remember the name of it. You'd probably know it, but it was an anti-craving medication, and he said it worked well for him. So that was cool. Yeah.
Yeah, there's a few different options there. And I think some people, right, they can do it without medications, and that's awesome when you can. There's some people who need a consistent medication. There's some people that need multiple. I've certainly had people that I've treated in the hospital that have needed 2, 3, 4 different types of medications, to help them. And I think all of that to say that these are serious things that can happen, and it's not a moral failing, and it's changes that are very biologically based and need to be addressed medically oftentimes, and behaviorally with support.
So I know that, I came to know you a bit through this effort to tell my story to some of the folks in the benefits team, and which has just been wonderful. More evidence that I'm in a great company. I think that one of the things we were going to talk about is our EAP program, right? And that there's literally people ready to pick up the phone to talk to folks for us 24/7 is my understanding of that.
Yeah, I think calling and, seeing if they can help connect to supports is really important. I think the folks, right, if there are folks at Life Connected specifically, right, whether it's the North Carolina site or the US site or the Bangalore or the Mexico sites, you can get direct support, right, if you go in and you make an appointment with a primary care doctor around this. But if you're not in those situations, calling Optum, I think, is a good next step. And then, right, using the SAMHSA website, which, if you're in the US, can be really helpful. Right, and I'm so sorry, I'm spacing right now in terms of the name of the program that also has the location finder that you're affiliated with. There you go. Shatterproof. I don't know why my brain just. It's a Friday afternoon. I've seen many patients, but yeah, Shatterproof also has that support finder. But I think Optum's a great place to start. And they can oftentimes direct to additional resources if they need to.
So we've talked a little bit about stigma and shame, and a word that you've used before when we've had conversations is the word normalization.
Mm-hmm.
Like, in this case, I'm outing myself as somebody, what I call long-term recovery. I'm a little over 9 years sober. I couldn't go 9 days sober, right? And the thought of that I could go sober for 2 days was hard, right? That was a mental block for me. And I'm hoping that by, putting my face on a screen and saying, hey, there's somebody in Cisco, I can guarantee you that there are hundreds of people in Cisco that are just like me, right? That are in long-term recovery. And, life is life, but wow, is it easier and more fun for me. And I hope that for others.
Yeah. And there are hundreds of people, I think, that are not in long-term recovery yet, that are at various stages of, right, short-term of early relapse, of, going through those cycles. And it's important to know that there is another side of it and that it can happen, because I think people can lose hope if they're going through that over and over again.
Yeah.
Yeah.
What do you think about relapse prevention? So I've heard it said before that stopping is easy, staying stopped is the hard part. What do you think about that?
I do think it's true. And I think it depends on, again, right, if you think about, we talk about it, or we talk about a lot of things in mental health in terms of predisposing, precipitating, perpetuating, and then preventative, right? So people can have a bunch of things that predispose them to something. Right. So in the case of alcohol, we talked about genetic. There can be epigenetic, which are changes that happen to your DNA after you're born, especially for people who undergo trauma or other changes. Psychosocially, what things happen to people growing up that make it more of a predisposition. What are they exposed to? It sounds like you started, drinking and using marijuana at a pretty early age. And so that can certainly then impact how your brain is forming, because your brain is literally forming around substances that are changing circuits as you go, right? And then precipitating what's caused it, and then what is continuing it to go, both internally and then preventative. And that's where relapse prevention can fall in there, right? And so when somebody has been drinking or using something for a long time, your brain needs, I'd say, minimum of a year. And they've actually done studies where they look at the brain scans, the fMRIs, which are functional magnetic resonance imaging of people who, use and then the day one of them stopping, versus a year later. And the neurons the signaling is just starting to go back to normal. So keeping somebody from not using so that their brain can actually go back to a different type of signaling is a process. And so that's where relapse prevention, that's where medication-assisted treatment comes in, AA/NA, which is, right, Narcotics Anonymous, other sorts of programs. There's lots of different types of therapy, and there's different levels depending on where people are at, right? Residential treatment programs, and detox programs. And so oftentimes evidence has shown it's a multifactorial approach that is the most successful when people are having a hard time.
Yeah. Yeah, and the way I look at it, and I'll just insert this idea from my perspective, until I wanted it for myself, I really didn't have a lot of shot at success. And then once I did, and now, I've heard people say it's the number one priority. It has to be for me. I've seen enough stories of what happens to people who give it a shot, see what happens. Many people that I've talked to. And if you have this condition, which I believe I have with everything I've got, if I'm not 100%, I'm in trouble, but I'm at 100%. So I do things, right? And this is, something to say, I'd love your thoughts on this too. What I don't want to be is the party pooper, right? Here comes Brett, everybody's at a function or whatever. I am going to take care of myself. I have to be responsible for that. But it does mean that sometimes I will just not go to things. And it's not like because I'm in jeopardy of drinking or anything like that. It's just I've learned that my priority is to take care of myself. It's a self-care thing. And I don't want to take a chance because I've heard the stories. It's for a lot of these people I know that have been sober 20 years. One guy I know I'm thinking of right now squeezed some apples, had some strong cider. Because I got this. 4 years.
Mm-hmm.
So I know it lies in wait for me. And so I do what I can to try to, I have to keep it out of my face, basically.
Mm-hmm. Yeah.
Like,
Yeah. Yeah. No, I think and it's amazing that you do that, right? Because I think it takes a lot. It's a complete lifestyle change, right? And a change in how you do things. But I think that it's also important that you know that, and that people most likely don't think any differently. I think a lot of that, right? You talked about shame. There's like the shame of what's going on for you, the shame and the concern about how other people are perceiving,
yeah.
and so I think that it's that focus on looking at it as this is something that you have to do for your well-being is a really good way of looking at it.
Yeah.
That's the most important thing, not what other people are going to think. But I think that a lot of people, right, don't talk about it because they're ashamed, because they don't know, right? They don't want to be looked at as someone who is broken or moral, or immoral or weak. And those are all, I've heard those, derogatory terms all the time. And it frustrates me to no end as a psychiatrist. I know when I think about the system in the US that I can treat people with depression and psychosis, and people recognize that those are mental illness that need, right, legal treatment, but you can't treat someone the same way for substance use because it's not recognized in the same way. I think New York is the first state that is starting to change those laws, but it is frustrating because it is based on kind of that puritanical moral way of looking at someone being, strong enough. If they're strong enough, they can do it. That's not how it is.
No. And the thought that maybe this could be of benefit or help a couple of people that are either in relapse or thinking about quitting, or maybe the people that are close to them, the people that love somebody who they see is having problems, because, what you're talking about here about brain chemistry, about, genetic predisposition, all these things, it's not badness. It's not moral failing. Some of the symptoms of this can be, as I protected the precious, right? Mm-hmm. But yeah, what would you say to, the spouse, the concerned mother or father that has a student in college? What do you say to that? Their concern about it?
That's hard, right? Because I think the family members, just like you need to take care of yourself, it becomes this balance of people taking care of themselves. Because I don't know how it was for your family, but I've definitely known families where it's been very destructive. But that drawing the line of support, like supporting that person, continuing to have conversations out of a place of concern and trying to get them connected to resources and recognizing when it's a point that they can't do it anymore. And I think that's the really hard balance to strike, because there is also Al-Anon, right, which is, for people who have family members who are, either for alcohol or substance. And so as much as they can support, but not to the point where they're in an abusive place, or they are, their lives are starting to fall apart because they're trying to take care of somebody who's not at a point where they can get that help and accept that help.
Yeah.
Yeah. And I think, even Cisco coworkers, right? I think if they've noticed a coworker that is, right, coming in disheveled, or who is, starting to show up late, or is, coming in smelling like alcohol, or they might come in sweaty, or they might look like, they might have their, shaky. Those can all be signs that someone might be, right, withdrawing, or intoxicated. And I think that if they notice that, it's hard, because what do you do in that situation? I'm wondering for you, did you ever experience that with employees or family members, and what was that like, and what helped and what didn't help?
No, I don't have a firsthand knowledge of that. I worked
Mm.
remotely the whole time, and I was somebody who never drank during work hours, but
Mhm.
come into the day, back to
Yeah,
my proud work hard, play hard thing, which was
right.
actually a terrible, this big thing of pride was actually the license to more destructiveness than I can imagine. But so no, I don't have a firsthand look at that. And I've been remote the whole time I've been at Cisco, so I haven't been in the office much.
Yeah,
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 which makes it tricky in the pandemic and all of us remote. Like it maybe has to be on camera that you pick up potential signals. And I'm a big believer that people with this condition are probably one of the best things they can do is try to get it out of their head and out of their mouth and into somebody else's ear, whether it's a professional like yourself or an AA meeting, or just go listen to somebody
yeah.
to find out that they're not alone is big medicine. What do you think about that?
I think have both on both sides of the aisle, if you are experiencing it, talking about it and reaching out and having that conversation and listening. And I think if you are watching somebody who's going through that, talking to them and talking to someone else. So SAMHSA, you can call SAMHSA if you are a loved one. You can call Optum if you are a loved one and you're concerned to try and get guidance on how you can get support for those situations. If you're a Cisco employee, you can call. And so I think that, you know, both sides communicating more is, I think, is always better because people can find out they're not alone.
Precious.
I think maybe as a last point to think about, like, what would our message to the people listening to this be? You know, what would we want them to take as a final thought after all of our conversation? What is important for them to know coming from this?
My opinion, so my answer to that would be like we've talked about. I'm not alone. I won't say you. I usually speak in the first person with my condition because I didn't really like people telling me what I should and shouldn't do. And I know I'm not alone. I know my condition is real. It's not imagined. It's not a problem of willpower. I know that sobriety is a wonderful way of life that I'm so grateful for, that I was able to be one of the lucky ones that escaped the clutches of the disease, and that the amount of bandwidth I have in my brain is that was full of so much obsession and Gollum-like thinking and behavior is gone. Life isn't perfect, but wow, is it easier? And wow, is there a sense of freedom that I have? So from a first person perspective, what I would like somebody to know is that's not speculative. I'm telling you firsthand that that is true for me. And I'm sure there's lots of ways to do this. You know, my way is however it had to be. And in my case, I had to find people and I had to start a process towards something. I had to let that little small voice out to others to hear and begin to take things in. And it was a process, and 9 years and some change later, I'm still in a good place. Okay. Your turn. What would you to take away?
I think first and foremost, right, I don't think we're trying to demonize, right? Because I think lots of people can drink alcohol, can smoke marijuana, you know, and can take, you know, opiates after a surgery and they're fine. And so I think first and foremost, right, that there's a spectrum. But if you're finding that you are in that spectrum, or you see someone that's in that spectrum where it is starting to impact your life, impact your ability to do things, impact your relationships with people, that, you know, that might be a point where you might think about, I might need help changing this. And that there is, right, trying to tough it out and do it yourself. I've heard so many people say that it's like, oh no, I can do this. I just need to do this myself. That oftentimes does not work, right? White knuckling it and figuring it out yourself oftentimes leads to relapse, or oftentimes just leads to you feeling miserable. And so you are not alone in this, right? As you're saying, right? There are people to reach out to, there are programs, there are, you know, providers, you know, like me who have expertise in this. You know, reach out to Optum, reach out to your clinic, reach out to Shatterproof. There are also many different things that can be there to provide support, and that, there's not something wrong with you as a moral failing, right? This is something that can be treated as a disease, just like any other thing. So if you have high blood pressure, you take medications, you change your life, you connect with people who can help support you through that, and you can get to a better spot. This is the same type of process. And so, I encourage everyone who's out there who this resounds with to reach out and connect.
What a lovely conversation. I just want to take an opportunity to thank you and Dr. Davis too for, the amazing work you've done through the pandemic, and what a joy it is to get a chance to talk to you and hear your words on this. 'Cause that I care about it a lot, and it's just really a joy to talk to you about it.
No, absolute pleasure talking to you and hearing your story. Thank you so much.
Wow, that was fun. I'm really, really stoked that Dr. Zein was willing to have that conversation with me. I'm hopeful she and I will get a chance to have additional conversations in the future. And thank you to the Cisco Benefits Team and Dr. Zein for letting me, put it on my podcast. If you or somebody is having trouble with drugs and alcohol, you might take a look at shatterproof.org as a place to start. There's lots of places to start, but that might be one to consider. And I'm really grateful to be sober, enjoying life as a sober person, and becoming more and more out there with my condition and my willingness to share my story and advocate so that people don't have to wait so long to find out that all that shame and stigma that is hanging on them because they're afraid to step forward. It doesn't need to be that way. It's a treatable disease, and there are a lot of people just like me. I've met hundreds. So anyway, I hope you enjoyed the conversation, and I hope that hope you'll listen to the next one. I put these out every other Thursday is my goal. So thanks a ton, and take care.